Hello, my name is Dr. Jonathan Greenland. I'm a radiation oncologist, but I'm also a MAID assessor and provider here in my home province of Newfoundland and Labrador. I'm going to speak to you today about what a MAID application process would look like in my province of Newfoundland and Labrador. For those looking for information on medical assistance in dying in Newfoundland and Labrador who are currently outside the hospital, there are several resources available on the internet. What I recommend you do is start by Googling MAID Newfoundland and Labrador or MAID NL, and that will bring you to several resources. One of them is a provincial resource called Frequently Asked Questions for Medical Assistance in Dying. So that's a PDF document you can open there, and there will be contacts to the various MAID coordinating services across the province. Newfoundland and Labrador is divided into 4 separate health boards. So the healthcare is provided by 4 separate entities, and each of them have their own MAID coordinating office. So you can call or reach out or email any of these 4, and that's a good place to start to get information. To arrange an assessment for eligibility, I'd recommend you talk to your healthcare provider first and make sure you have a good understanding of your condition and have a good in-depth discussion with your healthcare provider. Now, that person may not be very familiar with medical assistance in dying. If they are, they may be able to connect you themselves. But if they aren't, certainly feel free to connect yourself to one of these MAID coordinating offices. Once you've emailed or called one of the 4 offices, you should get a call back or a contact from one of them very quickly who will walk you through what's required and how the whole process would work in your area. If you're in hospital, it'll be very similar. The inpatient healthcare providers may have more experience and more knowledge of the MAID assessment, but they may not. But certainly that's a good place to start. Again, just to make sure you know from your doctor or your nurse practitioner exactly what your condition is and what options there are to treat your symptoms. But if you want to discuss MAID, you can discuss it with them and they can connect you. Or again, if you're having difficulty getting through to the MAID office, you can contact them yourself directly. So anybody requesting MAID assessment has to complete a declaration of intent form. That form is available through the 4 MAID offices. You may also be able to find it on the websites for the 4 health authorities. So I'd recommend actually contacting the closest MAID office in the appropriate health authority for you to get that information. It has to be completed and signed by the person requesting MAID. But if that person isn't able to complete the form physically, it can be done by a proxy. And that proxy just has to be somebody who's able to fill the form in on your behalf. The form has to be witnessed, and if the proxy is doing the form for the person requesting MAID, the witness has to witness the proxy signing the form. There has to be one independent witness. Besides being over the age of 18, that person who's witnessing can't benefit from the person requesting MAID's death. It can be a healthcare provider who's being paid, but it can't be a volunteer health provider. And if you live in a healthcare facility where you have to pay somebody to be there, you can't have the owner or somebody who owns that facility witness it for you. Other than that, it can be anybody really over the age of 18 who can understand the MAID process. So once the form is completed and received by the MAID coordinating office, and that can be faxed or emailed to any of the 4 offices, the offices then will coordinate the assessment. So anybody who's applying for MAID has to be assessed by 2 people. So they both have to be physicians or nurse practitioners. Once the assessors are defined, the assessors will usually contact you directly to arrange a time to do the assessment. They'll take some time just to understand your condition and the nature of the symptoms you're having and exactly why you're requesting MAID. You'll want to make sure you're not being coerced by somebody else to pursue MAID. So they may ask to speak to you individually, or they may not, depending on your circumstance there. But it's really more of a process to figure out, make sure that we understand why you're asking for it, to make sure you're a candidate for it, and more importantly, making sure you're not asking for MAID because you're having suffering that there could be a treatment for that you haven't been offered. Those assessments generally take place face-to-face in your home, in the hospital. In Newfoundland and Labrador, because of the geography here, we very commonly do these assessments by telehealth as well. In various circumstances, if somebody knows you really well, it might even be done by the telephone. But generally it will take as long as it takes. Generally it's not too long, but it might be an hour or so, or like a half hour to an hour. Once both assessments have occurred, if the person requesting MAID wants to go ahead with the procedure, that person will usually indicate a date where they'd like to go ahead, and the system here is generally able to accommodate that date or fairly close to it. We really try our best to really make that work as best we can. Sometimes it might be delayed a little bit if the healthcare provider is busy or engaged doing something else at that time. So a MAID can occur in your home or in the hospital or in really anywhere at all. There are some restrictions in some facilities in Newfoundland and Labrador based on religious commitments of the organizations that may own the building, but for most centers now, there's very few restrictions on where you can have it. Generally, if the procedure is going to happen outside of a healthcare facility, a home care nurse will go into your home just before the procedure, and the medications that we use are given by intravenous. We don't use oral medications for this process in Newfoundland, so they're given by IV. And the nurse will establish 2 good IV sites before the doctor or nurse practitioner comes in to provide MAID. The person providing MAID would be what we call the primary assessor. So be one of those 2 people that do the assessment with you. So then the physician or nurse practitioner will come to your home with the medications, and they'll check in with you before going ahead to make sure you still want to go ahead. It's important to realize you can call this off at any time. It's completely in the patient's control here. And generally that the doctor or nurse practitioner often will have a learner with them. Now generally you would be asked to make sure that's okay. There might be some learners there. There'll usually be at least 1 or 2 nurses there as well to help with the intravenous. It's important to think through too before the day of MAID delivery occurs, who you want to be there and any special requests. The procedure itself is generally very straightforward, completely painless, and it doesn't take very long at all.